Hi, welcome. My name is Alan Unell, and this is Healthcare Reform Advocacy. We present short videos with news and information that you can use to advocate for your own health and to advocate for a better healthcare system for all of us. We have two topics today. The first one has to do with Google. It turns out that when people search for abortion care services on Google, they're often presented with ads for anti-abortion clinics, so-called crisis pregnancy centers. These are not abortion care anything. What they are propaganda centers that try and convince women not to get the abortion. And the reason the ads are presented is that those centers are funded to the tunes of millions of dollars, and they pay for those ads. Well, that's not in the public interest, and it's actually against Google's stated policies. So what you can do is you can contact Google. Let me show you where. Contact Google. There's their address in Mountain View, California, and there's their Twitter handle, and there are their at least two phone numbers. If you go online, you can find others, and just tell them, I'm tired of you operating not in the public interest. Women get confused sometimes and wind up at a crisis pregnancy center instead of an abortion clinic, and that's not what they want. They don't want to be barraged with anti-abortion propaganda, and cut it out. Got it? Thank you. The next topic we have for today has to do with cancer. Cancer is a pernicious killer in the United States. It's the #2 killer of people, kills over 600,000 people a year. Of those 600,000, lung cancer is the worst cancer. It kills about 128,000 people a year. And not everybody smokes who gets lung cancer. About 15% of that 128,000 never smoked. I have friends and family didn't smoke, and yet they wound up with cancer, some of them winding up losing parts of lungs. It's horrible. Actually, some of them didn't survive. So what's needed? What's needed is research dollars to figure out how to treat and prevent cancer. It can be done. President Biden has authorized Cancer Moonshot. It's a noble goal. Cut the cancer death rate by 50% in 25 years. But it takes funding to do it. Now, last year, Congress authorized about $7.3 billion to the National Cancer Institute to fund cancer research. That was about a $400 million increase from 2022. That's good, it's in the right direction. However, the Republican-led Appropriations Committee this year has decided they're going to cut that budget by 8%. Apparently cancer isn't too important for them. But wait, it actually gets worse. It turns out that the National Cancer Institute, in order to meet the president's goals, actually needs more money than that. You'll see the top dollar figure up here, the $7 billion. That's their current budget, or close to it. They need an additional $2.4 billion for novel treatments, to develop them, for prevention, for early detection, and those are just critical to catching cancer early enough and doing something about it. Sadly, the Republican-led Congress has decided no. They want to cut by 29% the requested budget and even cut from the previous year. So what aren't we going to get since there's so little money in the pot? It turns out that revolutionary new ideas to stop cancer won't be available. Early detection programs won't be available. Prevention programs will be cut back, and they're likely going to have to cut testing back. That's where you actually learn what works and what doesn't. Because remember, we're making America scientific again. So if you stop some of those testing programs, even for a little while, you have to start over from the beginning. And these test programs are not short. They take years to run. So you're going to waste a tremendous amount of human effort and money, and lives will be lost. It's just not the right way to go. $9.9 billion is not a tremendous amount compared to that giant budget. They can do this. So what can you do? What you can do is contact your elected representatives, your congressperson and your senators, and tell them, cut it out. The National Cancer Institute needs $9.9 billion. Give it to them. Here's how you can do it really fast. On your cell phone, just text to the number 50409, sign PPLQRH. I'll hold it up there for you for a minute. And what that'll do is it'll send an email to your 2 senators and to your representative telling them exactly what I've told you. Give them the money. They need it to save lives. Thank you. I appreciate your attention. Be good advocates.